Neuralink intends to use its microchips to treat conditions such as paralysis and blindness, and to assist disabled individuals in using computers and mobile devices. The chips, which have been tested on monkeys, are designed to interpret signals produced by the brain, and relay data to Bluetooth-enabled devices. Experts have cautioned that extensive testing will be required to overcome technical and ethical obstacles before Neuralink's brain implants can become widely available. Elon Musk has previously suggested that the proposed technology could help alleviate concerns regarding the displacement of humans by AI. Welcome back to my channel. Neuralink, kickstarting transhuman evolution. Neuralink Corporation is a California-based American neurotechnology company developing implantable brain-computer interfaces, BCIs. Neuralink was founded by Elon Musk and a team of 7 scientists and engineers in 2016, and first reported publicly in March 2017. In April 2017, Neuralink declared its intention to produce devices to treat severe brain diseases in the near future, with the ultimate goal of human enhancement, also known as transhumanism. Elon Musk stated that his interest in the concept stemmed in part from the science fiction concept of neural lace, depicted in the novel The Culture, by Ian M. Banks. Musk described the neural lace as a digital layer above the cortex that would ideally be implanted through a vein or artery, rather than requiring extensive surgical insertion. He stated that the long-term objective is to achieve symbiosis with artificial intelligence, which he views as an existential threat to humanity if left unchecked. He believes the device will be something analogous to a video game, such as a saved game situation in which you can resume and upload your last state, and will address brain injuries or spinal injuries, and compensate for a person's lost capacity using a chip. In April 2021, Neuralink demonstrated a monkey playing Pong while implanted with its technology. While similar technology has existed since 2002, when a research team demonstrated for the first time that a monkey could move a computer cursor using neural signals, scientists have acknowledged engineering advancements in making the implant wireless, and increasing the number of electrodes implanted. Reports from 2018 shown that Neuralink remained extremely secretive about its work, despite the fact that public records revealed the company had sought to open an animal testing facility in San Francisco. It subsequently began conducting research at the University of California. The Neuralink team revealed the technology of their first prototype in 2019, during a live presentation at the California Academy of Sciences. Ultra-thin probes will be inserted into the brain, a neurosurgical robot will perform the operations, and a high-density electronic system will be able to process information from neurons. A brain-computer interface, BCI, also known as a brain-machine interface, BMI, or smart brain, is a direct communication channel between the electrical activity of the brain and an external device, most frequently a computer or robotic limb. BCIs are frequently used to study, to map, assist, augment, or repair human cognitive or sensory motor functions. They are frequently conceived of as a human-machine interface that bypasses the intermediary component of the physical movement of body parts, but they also raise the possibility of erasing the distinction between brain and machine. Based on the proximity of electrodes to brain tissue, BCI implementations range from non-invasive like MRI, to partially invasive like endovascular, to invasive like microelectrode array. In the 1970s, Jacques Vidal at the University of California began researching BCIs using a grant from the National Science Foundation and a contract from DARPA. The expression brain-computer interface first appears in scientific literature in Vidal's 1973 paper. Due to the brain's cortical plasticity, signals from implanted prostheses can be processed by the brain like natural sensor or effector channels after adaptation. The first neuroprosthetic devices implanted in humans appeared in the mid-1990s, after years of animal testing. Recent studies in human-computer interaction using machine learning to classify mental states like relaxed, neutral, or concentrating, mental emotional states like positive, neutral, and negative, and thalamocortical dysrhythmia, have achieved a high level of success. Probes made primarily of polyamide, a biocompatible material, with a thin gold or platinum conductor, are inserted into the brain by a surgical robot, using an automated process. Each probe consists of a region of wires containing electrodes capable of locating electrical signals in the brain, and a sensory region where the wire interacts with an electronic system, to enable amplification and acquisition of the brain signal. Each probe is comprised of 48 or 96 wires, each containing 32 independent electrodes, for a total of up to 3,072 electrodes per formation. Neuralink claims to have developed a surgical robot that can rapidly insert a large number of flexible probes into the brain, thereby avoiding the tissue damage and longevity issues associated with larger and more rigid probes. This surgical robot's insertion head has a tungsten rhenium needle that is designed to attach to the insertion loops, inject individual probes, and penetrate the meninges and cerebral tissue. It is capable of inserting up to 6 wires or 192 electrodes per minute. Neuralink has designed an application-specific integrated circuit, ASIC, to create a recording system with 1,536 channels. This system consists of 256 individually programmable amplifiers or analog pixels, on-chip analog to digital converters, ADCs, and a peripheral circuit control to serialize the obtained digitized information. It aims to convert neuronal data into a comprehensible binary code, in order to gain a deeper understanding of brain function, and the ability to stimulate these neurons. With current technology, electrodes are still too large to record the firing of individual neurons, so they can only record the firing of a group of neurons. Neuralink representatives believe this issue could be resolved algorithmically, but it is computationally expensive, and does not produce precise results. According to Elon Musk, Neuralink obtained a breakthrough device designation from the FDA in July 2020. This permits limited human testing under FDA guidelines for medical devices. Neuralink tests their devices by implanting them surgically into the brains of live monkeys, pigs, and other animals. The methods of Neuralink have been criticized by organizations such as PETA. From 2017 to 2020, Neuralink conducted experiments on monkeys, in collaboration with University of California, Davis. At the conclusion of their collaboration, UC Davis gave 7 monkeys to Neuralink. In 2022, the Physicians Committee for Responsible Medicine alleged that Neuralink and UC Davis had subjected several monkeys to psychological distress, extreme suffering, and chronic infections as a result of surgical procedures. They believes that 15 of the monkeys who participated in experiments died or were euthanized as a result of the experiments. In addition, it is believed that there are concealed photographic and video documentation of the mistreatment. In February 2022, Neuralink stated that macaque monkeys had died and been euthanized as a result of experimentation, while denying any animal cruelty. Musk previously stated that Neuralink implants could be implanted through the jugular vein, rather than by opening the skull, as is currently required for Neuralink. In December 2022, it was reported that the United States Department of Agriculture was investigating Neuralink for animal welfare violations. In addition, a Reuters report cited claims from several Neuralink employees that testing was rushed due to Musk's demands for quick results, resulting in unnecessary animal suffering and deaths. However, in May 2023, Neuralink received FDA approval for human clinical trials. The FDA had previously denied approval for human clinical trials in 2022, citing major safety concerns involving the device's lithium battery, the potential for the implant's tiny wires to migrate to other areas of the brain, and questions over whether and how the device can be removed without damaging brain tissue. By connecting brains to computers, the Neuralink implant company intends to restore people's sight and mobility. It states that there are no immediate plans to begin participant recruitment. Mr. Musk's previous plans to conduct tests were unsuccessful. Its announcement regarding FDA approval at the end of May 2023 for human trials follows news of a similar breakthrough involving brain implants made by Swiss researchers. Musk has publicly outlined an ambitious plan for Neuralink over the years. He made headlines late last year when he stated that he was so confident in the safety of the device that he would implant it in his own children. Musk envisions both disabled and healthy people receiving surgical implants at local centers in a timely manner. These devices aim to treat a variety of diseases, including obesity, autism, depression, and schizophrenia, as well as enable web browsing and telepathy. Thank you for watching.